Well, a tummy tuck might be considered for various reasons. Commonly, it's after pregnancy. So women after pregnancy who have redundant skin and fat and sometimes stretch marks, so it won't the tummy won't go back to how it was. Often it's also with weight loss, so it's a similar situation. You've got excess skin and fat and sometimes stretched skin that won't go back despite exercise. So taking away that excess can improve the contour. Sometimes for both reasons, we also need to repair the tummy wall because of weakness and discomfort, and also because of appearance. And the last reason tends to be to improve scars. So sometimes patients come with scars from previous surgery or previous injuries, and sometimes us doing a tummy tuck can improve the scars and hide the scars under underwear. So it's a good way of doing that as well. It's described as a mini or a full tummy tuck, a standard tummy tuck. So starting with a standard tummy tuck, that really means that we're going to take more tissue away. So the resultant scars are usually from one hip to the other. So it's right across your tummy, hidden in the knicker line, and a scar around the belly button. So it's usually a bigger procedure. The mini always makes it sound like it's a smaller operation. It's still taking tissue away, but usually it means that the scar is shorter and it's in the center of the tummy. So basically above where the pubic area is. So you take smaller amount of tissue. Sometimes you don't make a scar around the belly button because you can just pull the tissue tight, but it's usually for a less obvious problem with the skin. So it's mini in terms of it's a more modest operation, but it's still obviously got risks involved. So a tummy tuck is normally performed under a general anesthetic. So it's coming into hospital and having a full operation, and usually staying at least one night in hospital afterwards. And what it involves is obviously going to sleep for an operation, and usually making a cut from one hip to the other along where the waistline would be, so along where the sort of knicker line would be. And it's pulling the skin and the fat downwards and taking the extra tissue away and hiding the scar. And at the same time, we reposition the tummy button and sometimes have to repair the tummy wall where the muscles have become relaxed. We can also reinforce that to strengthen the tummy wall and improve the shape of the tummy. And that's the sort of the major surgical bit. Sometimes on top of that, we do liposuction as well. And liposuction is basically a way of just taking away unwanted fat. So it's using a long needle with a suction device and basically taking fat away from different areas. So sometimes I will use that, particularly on the sides of the tummy, what they call the flank area, to try and improve the shape. And sometimes when there's extra fatty tissue in certain areas, to basically smooth things out and give the best contour possible. So sometimes we do one or the other. Quite often I do both because it gives us the most pleasing result at the end, all in one operation. The results, usually I'd say after about 6 to 8 weeks. It takes time for healing. So it's still quite a big operation. Usually it's on average about 3 hours of an operation, and the recovery takes about 6 to 8 weeks. So it's like if it's a lady and they've had a pregnancy and they're recovering after pregnancy or cesarean or having any sort of major operation on the tummy, it's 6 to 8 weeks of recovery. There will be some swelling and bruising and some soreness, and then you tend to see the sort of final result at about 6 to 8 weeks when the swelling has gone down, when the scars are starting to heal and mature. So they go from bright pinky purple scars, they start to fade. So on average, you see roughly the end result in a couple of months, but obviously the healing process in total takes a bit longer than that. The scars will gradually fade over about a year, but at 2 months you can hide them under underwear. You can do whatever you like. You're back to your normal routine. You can do your fitness and back to your full working potential. I never promise that patients that the tummy will be completely flat. And obviously, if you look at social media, that's what everyone looks like. And I think, to be honest with you, that's very difficult to achieve unless you're very, very fit beforehand and you're just taking some skin away. Usually with time, there's a little bit of relaxation of the tummy wall. So you're dealing with the outside mainly. So what we're improving is the overall appearance, so the overall shape. So in clothing, it's much improved. You don't get an overhang of skin and excess, and you can be more confident in clothing. But completely flat, like a washboard, is very difficult to achieve. So what I normally tell patients is that the overall contour is better, but if they were a little bit of a rounded tummy, that will still be the same after the operation. In terms of how many sizes, again, every body shape is different. So what we need to do on an individual basis is work out how much tissue we think we're going to lose. The actual sort of dress size, if you like, I think is a difficult one to sort of gauge. But give or take, you're going to, if you take away a large amount of skin, you're just going to be wear more fitting clothes, not necessarily lots of sizes smaller, but you will just look better in the clothing that you were wearing beforehand. It's not a way to lose weight. It's not a way of cheating. It's just a way of getting, once you're as healthy as you can be, just getting an overall better contour and a better body shape. The results for tummy tuck, I think if you maintain a healthy lifestyle, it can last for years and years. I think the risk is always that you want to use it to sort of lose weight or if you like, shortcut the system. I think if you're in a good weight and you're good health and you have the operation and you maintain that weight, then actually the results can last 5-10 years. If obviously you lose more weight afterwards, or you unfortunately put on more weight, then actually the results will change. So it's really important to stay healthy afterwards, and before you even start on the operation, get to the weight you want to be at, so that you can stay there and be confident that your results and what what operation you've had, it lasts as long as possible.